Hi, I'm Ramsey Choucair, a board-certified plastic surgeon in Dallas, Texas, and today we're going to continue to talk about body contouring and talk about liposuction. So liposuction has been around for many years and is a tried and true, predictable way to remove fat in areas that are resistant to exercise and diet. So there's certain areas of the body where liposuction is more successful than others, but it always comes down to the elasticity of the skin, because liposuction, as you know, takes fat, if that's your muscle and that's your skin, and it removes the fat layer. The key is, will the skin shrink and look good enough that you're happy that you did the procedure? You may be smaller, you may be fitting your clothes better, but if your skin doesn't look as tight and smooth that you had expected, then you may be disappointed. So the first principle that most all surgeons know is that, will the skin redrape and look good enough that even though we've made you smaller and your clothes fit better, that you're happy with the way the skin looks? And that's a judgment call when the surgeon evaluates your skin. So the area that we were concerned the most with is the abdomen, especially in women who've had children, because the skin can sometimes relax. And of course, you also have to factor in the abdominal wall relaxation that sometimes occurs with having children. So the abdomen is one of the areas that requires a little more thought process. The hips or the flanks are areas where the skin is thicker. The skin rebounds much better in the hip and flank area. So liposuction is usually very successful there, and rarely, if ever, do we remove skin, as opposed to in the abdomen, where sometimes if the skin is a little loose, you would remove some skin. The thighs are kind of in the middle. In many cases, the thigh skin can be slightly rippled or irregular on the surface. And some patients think that liposuction will help the surface texture or the surface dimpling of the skin. And that's just not the case. In fact, liposuction can make the surface wrinkling of the skin, and again, the surface wrinkling, more pronounced, because again, you're deflating the skin to a certain degree. However, liposuction of the circumferential thigh, the upper thigh around the thigh, can make someone who has a hard time wearing a pair of jeans or slacks suddenly slide those slacks right on, because you can really make the circumference of the thigh much smaller. So the arms are another area that in many cases patients can't wear certain outfits because genetically and their arms are fuller than they want, and despite exercise and diet, they can't reduce it. The arms can be a very successful area for liposuction. Again, because when you suction an arm, you're suctioning a cylinder, and when a cylinder shrinks circumferentially, it tightens reasonably well. So all these factors go into the decision by the patient and the surgeon about what kind of expectation you can get from the surgery. So make sure you go over all these issues with your surgeon and be sure you know what you're getting on the other end of liposuction.